You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment for patients that are suffering with TMJ disorder, with jaw pain, neck pain, even back pain. With us, we have an expert on the topic. He is Arkansas oral surgeon, Dr. Bolding. Dr. Bolding, welcome to the program.
Thank you, Randy.
You know, I say Arkansas surgeon. I mean, you are the surgeon for the Razorbacks.
We're fortunate enough to be the dental providers for the Arkansas Razorbacks, which is a proud honor for our practice.
Okay, good. Now, for people that don't know you, I have a lot of questions about TMJ, you know, what are the symptoms, et cetera, and what you do. But tell me a little bit about your practice as an oral surgeon, because you do a lot of things.
Sure. We have 6 surgeons in our practice. Our practice is called the Oral Facial Surgery Center. Okay. We do everything from simple dental extractions to complex TMJ disorder and surgical management of craniofacial disorders and birth defects, dental implants, facial trauma.
Okay, at the top of the show I said TMJ disorder. What defines it and what are the symptoms?
You know,
somebody watching this, maybe help them self-diagnose, I guess.
Well, there's a lot of patients that say, I have TMJ. Well, all of us have TMJ. It's kind of like saying you have knee.
Right,
but TMJ disorder means there's something wrong within the jaw joint. It could be a simple click and pop. It could be that you're missing a tooth and it's caused a little bit of a headache. It could be that you're having headaches. It could be that you're having muscle stiffness in your neck. It could be that you're having grinding noises inside your jaw joint. It could be a number of things. It may be related to eating or chewing or even sleeping.
But these people have symptoms, though, specific where it hurts.
Right.
Or they have short teeth. And do these people have a diagnosis of TMJ disorder? And who does the diagnosis?
Well, many times TMJ is misdiagnosed. We have patients that have been to the physician many times for headaches or ear pain. One of our strong referrals is the ear, nose, and throat surgeons. Okay. Because they will go to the ENT surgeon thinking that they've got an earache or think they have pain in their ear, and the ear surgeon will look in and say, it's not your ear, it's your jaw joint.
Really? And so you don't necessarily have to have a sore jaw to have TMJ disorder?
Well, many times the pain is right in front of the ear because the jaw joint is so close to the ear that you think it's an ear infection.
Okay, now you brought some skulls. Is there something to help me understand a little bit more about what we're talking about?
Well, when we're looking at the anatomy, when the jaw joint is functioning, as you open and close your jaw, the jaw joint is moving back and forth. And interestingly, with this joint has 2 joints. There's the right side and the left side, and you can't move your right jaw joint without moving your left jaw joint, so they work together. And the joint is so close to the ear that many times the pain is perceived as an earache. And you can see with the jaw joint is very close to the ear canal.
So then what are if you had to categorize the TMJ patients that come to see you, what are they?
Well, they're from simple things like headaches,
okay,
popping and clicking in your jaw joint, grinding, ringing in your ear pain, neck pain. You can have even isolated headaches in the morning, or they can be in the afternoon. You can have difficulty eating, difficulty closing, difficulty opening. There can be a number of symptoms that can be associated with temporal joint disorder.
Now some of the things, because you do implants and things like that. I mean, right, in the jaw. So there are people that also have chronic problems that have been suffering for many years.
That's right. I mean, there are patients that have had severe degenerative joint disease. So they can have complete resorption of the bone of the jaw joint, much like a hip or a knee. So patients that go into an orthopedic surgeon that have degenerative arthritis in the shoulder or in the knee or in the hip, and you can have that same condition within the jaw joint.
Is that being missed also, as far as diagnosis?
Well, many times the dentist may even miss the fact that the patient's coming in with worn teeth, fractured teeth, or starting to lose teeth, and they're treating the dental situation and not understand that it's actually a degenerative joint.
But the good news is you see reversals in symptoms every week in your practice, every day in your practice?
Randy, we see a lot of changes. For example, we had a patient recently who was actually a physician. She was a medical student, and she had been going to her physician colleagues for a number of years for ear pain, and they were treating her for headaches, ear pain, and totally missed the fact that her bite was changing. And so by the time she had seen me, she had no bite. She had a complete open bite. She had to drop out of medical school because she couldn't finish because of the pain, and she was on all these high dosages of pain medications. No one had taken an MRI of her jaw joint. No one had looked at her jaw joint. So this is a physician that had actually been suffering for 10 years with this problem. And now within 3 to 6 months, we had to replace her joints with artificial joints, but she's pain-free and now studying back for her residency to finish out her medical training.
But is that common, like that woman? Are there really that many people that are out there with these problems with their...
Randy, there are a lot of patients suffering from these symptoms. Some of them not as severe as hers. I mean, it's not as common, but they're having headaches constantly, or being told by their physician or even their dentist that this is something that's not treatable. This is something that you just need to take a pain medication and treat it with pain medications rather than a treatment, which is whether it's non-surgical or surgical, that can manage the condition.
Have you had migraine patients, and I'll put you on the spot here, that the migraines are gone?
Well,
long-time sufferers.
Let's classify migraines. Temporomandibular joint disorder is not migraines.
Okay.
TMJ disorders usually are myofascial headaches. So in other words, your muscles activating either all night or all day, and it's causing the tension. It's much like this. I tell patients you have a dumbbell, and you're lifting this dumbbell all night long, so your muscles are activating all night long. In the morning, your muscles are going to be real sore. Well, if those muscles are right here in your jaw, then you're going to call those headaches. And many times they're misdiagnosed as migraines when actually they're myofascial headaches. So I call it the TMJ trilogy. I don't know of anyone else that calls it that.
Okay.
But the TMJ
the trilogy. Okay.
The TMJ trilogy. There's 3 components in my analysis of TMJ. There's anatomy problems. So you've got a cartilage problem, you've got a ligament problem, you've got a bone problem. True anatomy problems in the jaw joint that can be treated either non-surgically or surgically. Then you have hypermuscle activity. So for some reason you're either grinding, and you're grinding because you're stressed, you have something inherently wrong with your jaw joint that's making you clench your muscles. For example, if you have a bulging disc in your back, you've heard of back spasms.
Yeah.
You can get those same spasms in your head and neck area from a displaced disc in the jaw joint. So you get that hypermuscle activity. And then the other component is the psychological component. I mentioned stress. So if you have a stressful condition or something that's bothering you all day, it may lead to hypermuscle activity. And if you have enough hypermuscle activity, let's face it, if you're standing there grinding your joint all night long, you may cause an anatomy problem. And they all actually intertwine.
So these grinders, because I've talked to dentists on my show, and they will say, you know, we tell them you're grinders, and they're in denial. They say, I don't know, I don't grind. But what do you have to say to those grinders? Where are they headed? Are they headed for problems?
Well, absolutely. And
all of them?
Now, not all patients are grinders. They may just be clenchers. For
but
example,
the ones that have been told they're grinders.
if they're grinders, they need some protection. I would it's much like if you have a bad knee. Let's say you have a weak knee or a torn lateral collateral, but it's not surgery. What will the orthopedic surgeon do? He'll put you in a knee brace every time you go play basketball.
Okay.
Right?
Yeah.
With a splint, we can treat many patients, and that's what many dentists do. They'll put a splint designed for the patient, not an over-the-counter splint, but one that's custom designed for the patient to disengage the teeth a little bit. And what that does is it takes some pressure off the jaw joint so that when the patient's sleeping at night, it keeps the teeth apart. It also separates the jaw joint a little bit so that you're not overloading the ligament, overloading the disc, causing that inflammation. And it'll also stretch the muscles and many times decrease that muscle activity so that you're not clenching as much at night.
It's almost like a discipline of dentistry. Is that correct?
It is.
TMJ?
It is. There's very few surgeons that do surgical management of TMJ for a lot of reasons.
Why?
Because many of them don't like to deal with a chronic pain patient. But I find personally that it's very gratifying taking these patients that have been either in long-term chronic pain or even acute pain and helping them with their condition. I mean, I get a lot of gratification in those patients that I can help relieve their symptoms, get rid of their pain, and get them back to their normal life.
Okay, now let me ask you a question, because people always, they visit our website at wellnesscenter.com and they email us for referrals all the time, and we're not a referral site. In fact, people need to know this is a real interview, and I'm not siding with you, even though it sounds good what you're talking about, right? And I'm not endorsing you. But they ask me, and our response is, see a specialist. I mean, somebody that this is what they do, which is what you do. Now, people travel to see you. for TMJ. Is that right? I mean, you get the tough cases.
They do.
Is that true?
We have a lot of patients from all over the country that come in to see us at our center for both non-surgical management and surgical management.
Now, if we had to brag about yourself, have you had people that have been to other dentists, other oral surgeons, whatever, didn't get the results and you got the results? And if so, what did you do differently?
Well, I think really just listening to the patient and really going. We have a system where we completely analyze every patient from a facial balance, from the functioning of their jaws to their bite, analyzing their radiographs, and we really try to take all of the components of what the patient's problems are and put it together in a very comprehensive plan.
Okay, you published articles on TMJ?
I have.
And now the patient population that's out there, what are the frequently asked questions? What do they want to know? So take me in on that consult. So they go on the consult, they have jaw pain, neck pain, migraine, headaches. I guess that you're sometimes the last resort. What do they want to know?
Well, first of all, they just want to know if I can help them. Many times they've had several rounds of pain medications. They've had different types of splints. They've had different types of treatment. For example, I had one patient who had been to several physicians and he had been to several dentists. One of the dentists had replaced all of his teeth with crowns. This guy was 26 years old.
Okay.
And no one had ever taken an MRI of his jaw joint. And so there had been no evaluation of his joints whatsoever. So he'd had all these treatments, very expensive treatments, and no one had really paid attention to his jaw joints.
So you took the MRI.
Took the MRI, found that
in crystal clear way, you see the problem.
he had severe degenerative joint disease. And
Interesting.
It had totally ignored the problem. We had to put artificial joints. There wasn't any other option for him. And he is a family today and doing very, very well.
I had a guy, and knowing that you're coming on the show, told one of my buddies, he's a medical doctor, he says, well, I'll tell you what they're doing, Randy. They're just carving down all the teeth, rebuilding the mouth just to make it balanced bite. But that's not what you're doing.
That's not
so
what
what
we're
is
doing.
your response to that? And is that one technique that is being done?
Well,
like the one guy you just mentioned.
My response to that is we have learned through the years that we take an orthopedic approach.
Okay.
For example, if you have a missing tooth, and many patients will just have a tooth removed, the dentist will remove a tooth, and they will not replace it with an implant or anything, and it's just a hole that's in the mouth. Well, what happens is that creates an imbalance.
Okay.
And that can cause a jaw joint problem. It's much like if you were walking around with one shoe on and one shoe off, what that would do to your hips.
Interesting. Okay.
And so there is some truth that there is a bite component to it. So having a balanced bite is very important. But many times we just focus on one aspect of the problem and not really look at everything together. I mean, like I said before, you've got the jaw joints, you've got the muscles, you've got the neck, you've got the teeth, and they've got to work together. So it's a complex system.
But does it cost more to go to an oral surgeon?
No, not at all.
Interesting. Good. Because we always tell people, and I'm not trying to throw my opinions in here today, but I think, look, you do splints, right?
Right.
I say go to somebody that does everything, because that way you're not just going to splint everybody. It
Right.
may be a little bit deeper for them. And so is that common there, not MRIing the area? Is that and how important is that?
Well, many dentists don't even know how to order an MRI because it's not part of our training.
Okay.
And then the physicians are not used to ordering MRIs within the jaw joint area. Many times we'll get a patient that's had an MRI of their brain because they've had headaches, right? But they didn't focus on the jaw joint.
So you have a splint over there.
I do.
All right.
This is a splint. This is a custom-made splint. So we use a digital scan for our patients, so everything is done with CAD/CAM design. But this simple splint can be all that a patient may need to relieve some of their headaches, relieve some of the muscle tension in the jaws, giving them a better balanced bite and taking some pressure off that jaw joint. So this is the first line of treatment many times.
Do you wear a splint, by the way?
I don't.
You don't?
I don't have any jaw joints.
Okay, no problem. And but there are people that go in and this is it.
This is it. This is many times this is the only treatment that a patient will need.
Okay, what's the next level up then?
If the bite management is not relieving the symptoms, and then we want to look further.
Okay.
That's when we would order an MRI and look in the jaw joint and see if we're having having a disc disorder.
Okay.
So within the jaw joint, what we have, the normal function is when the jaw opens, there's a little cartilage pad that sits between the lower jaw and the base of the skull. I call it God's pillow. It gives a cushion between the joints.
All right.
And as long
Do you
as
show this to patients just like you're showing me?
every day, and
Okay.
show them this is the normal function. Now, if this little cartilage pad gets displaced, either due to trauma,
Interesting. So does that pretty much what happens?
that is what happens.
That
So
little
when
pad
that
gets
happens,
displaced.
you can get the little pop and click. That's where the pop and click occurs.
Interesting.
And then if this disc stays displaced, now you're functioning on the ligament. Remember?
Is that where they're headed, by the way? I mean, if you're getting popping and clicking, one day it's going to
That's
move.
right. So early popping
Okay.
and clicking it's important to make sure that your bite is managed well. So that's where the splint comes in, or working with your dentist to make sure you've got a good bite. Because once that cartilage displaces, now you're functioning on a ligament. Well, the cartilage has no blood vessels or nerve endings in it. The ligament is full of blood vessels and nerve endings in it. So you can imagine if you're squeezing on that ligament all day, the inflammation, the potential pain, and then
Will they feel pain in that area?
many
if they have
times,
it?
many times.
Sometimes they don't.
Sometimes you don't.
How do you as a surgeon, I mean, what do? You're going in from the inside and doing what?
Well, if from a surgical standpoint, if we end up the conservative therapy is not working, splint therapy is not working, medications are not working, then we may need to take an orthopedic approach and do a ligament repair, much like you would have for your lateral collateral
And
tear.
what's that like?
So what we do is we make a small incision on the inside of the ear, go in and reposition the cartilage back on the head of the condyle, and repair the ligament. Then what we do after that is done, then we make sure that the bite is managed well. So we'll put the patients back into the splint. They'll wear that splint for about 2 to 3 months. The patients will
Is
go.
that fairly a routine operation for you?
It is. We do it weekly.
Is that right? So that's a common area. And
is.
popping and clicking, that little pillow, what do you call it again? You have a line
disc.
for it? The disc?
Oh, God put a little pillow between the jaw joint and the
Little
base
pillow
of the
there.
skull.
So you have people, though, that after this procedure, that their pain goes away?
Well,
has that ever happened?
Not always immediately, but yes, we've had patients that they've got instant relief from their headaches, and within just a very short period have no symptoms in their jaw joint.
And what is that surgery called? What's that?
This
what's
is
that
called
technique?
a TMJ arthroplasty.
Is that a common procedure that oral surgeons do across the country?
I wouldn't say it's a common procedure that all oral surgeons do, but there are select oral surgeons like myself that do a lot of TMJ surgery. And I would recommend all patients that are going to have potential for TMJ surgery to go to the surgeons that do a lot of TMJ surgery.
What do you ask? What do you ask of a doctor that's going to do it? I mean, what are you supposed to ask?
Well, that's easy, Randy. You would ask, how many of these do you do a year?
Interesting.
Do you do these frequently? What's your results? What's your outcomes? Can I talk to patients that have actually had this done before?
So when going into this interview, when I think of going to the oral surgeon for TMJ, you're breaking jaws every single time. That's just not true.
That is
right?
correct. That is correct.
That's like far from the truth.
Yeah, with TMJ, you're not breaking jaws at all.
Is that right? But you're going in and you're just kind of doing an inside, you're moving it over, rebuilding the what?
It's very similar to a knee repair today that many patients
Okay,
know
it's
about.
like a knee repair.
So we're repairing that ligament and putting that cartilage pad back on the head of the condyle.
Doctors will watch this show. What do you want them to know about what you're doing? Because I guess there's a lot of misinformation, or not a lot of information. Just to come in, get evaluated?
Absolutely. I mean, what I would tell my colleagues is that there are options now available for the temporomandibular joint. I think there's a misconception that there's no options for many patients, and they suffer long term with headaches, chronic pain. But there are some solutions today that are available, that are working well, and are managed well.
Would you say there's tens of thousands or more in Arkansas that are suffering with problems related to the joint problem?
Well, I don't know for sure, Randy, but I would.
But thousands you think are suffering that don't have to be?
Absolutely.
Really? Okay, so what's the next level up for that you offer for people with TMJ?
Well,
so we talked about the splint, we talked about that. What else?
This would be a patient that the arthroplasty is for someone that has a ligament torn. But if you have the patient like I spoke about earlier that had the degenerative joint disease, in the old days there really wasn't a lot of options. We were doing things like rib grafts and collarbone grafts to try to replace that jaw joint because we didn't have any options. About 20 years ago, there was a company that put together an artificial joint similar to the components of a knee or a hip.
Okay.
And so this is another procedure that we do called a total joint prosthesis. And
wow.
this is a artificial jaw joint and an artificial fossa, and it replaces the condyle or the jaw joint bone, and it also replaces that disc. And this gives patients with degenerative joint disease a much better option than we had in the past.
So is this one of the procedures that you do that's unique to your practice?
That's true.
People
There's not many of us around the country, actually around the world, that do this particular procedure.
Are those titanium?
Actually, this
how does the body work with
this? Is titanium, so it's the most biocompatible metal that we have. It's the same metal we use for dental implants. And then you have a high molecular weight polyethylene, and then you have a chromium cobalt head that goes up into the joint.
And how long will those last?
We don't know. We've had them around for about 20 years.
Do you have patients that have been in 20 years?
We do.
Seem to be fine?
And the studies are showing very good results long term. If you go to an orthopedic surgeon and get an artificial hip or an artificial knee, they'll tell you it may need to be replaced in about 15 years. Today, we're not seeing that yet in the jaw joint. We don't know why, other than probably we don't have the same load variables that you have in those other
Tell me
joints.
about pain. With some of the things that we're doing, the procedures, like the one where you were talking about where you take care of that little pillow there in the joint, and this one, what do the patients say?
Most of the patients will have a surgical soreness after the surgery, but within just a few months, that pain is going away. So what many patients will say is, the pain that was there is gone. It's just a surgical soreness that I have. And then with time, as we strengthen the muscles, balance the bite, then those symptoms go away.
So is this one of those surgeries that is a new breakthrough?
It is.
You lecture on that topic?
I do.
And what's the learning curve, by the way?
Well, Randy, when I was a resident, we did several hundred of these. I was very fortunate to be at a training program where this was offered as an option. So the learning curve is fairly steep. You will want to go to a surgeon that has extensive experience in this
What is the
procedure.
name of that surgery? If somebody Googles it or wants to know.
This is called a total joint reconstruction, or an artificial TMJ joint.
And that sounds pretty dramatic, by the way.
It's just like an
But it's not.
It's like an artificial knee, artificial hip, and as we know, they're being done all over the world now.
And not a lot of oral surgeons do this.
Not
like
many.
what percentage would you say?
There's probably around 50.
50%?
Somewhere between 50, no, there's probably a total of around 50 to 100 surgeons in the world that are doing these procedures.
Is that right? You're one of the guys.
Right.
And so you publish papers. I mean, what drives you? Why on this cutting edge kind of thing?
Randy, I love what I do, and I've always challenged myself to try to be the best. And so it's like not going to work every day.
And you're big on the whole patient experience as well.
Right.
I mean, you're also a consultant to other oral surgeons.
I am.
You help them with that whole process.
What I've strived to do is to not only help my patients but help our profession, and I really feel honored and blessed to do what I do, and it's a big part of my life, and it's a calling, if you will, and I really can't describe it other than I just enjoy what I do.
Does insurance cover any of the procedures that we've talked about at all?
Many times insurance will cover some aspects of the TMJ management. Not always.
Like up to their maximum payout per year kind of a thing?
That is correct.
Okay. But these people are happy. Now, tell me about the success rate of the people that you're actually doing that joint surgery.
Our patients are happy, and many of my colleagues don't treat TMJ, and they'll say, well, we don't manage TMJ because it's hard to deal with that patient.
So the locals go, send Bolding those guys, Dr. Bolding.
But we've had great success. We practice in a smaller state, a smaller community, and I tell everyone around the country, if we weren't getting success, it would be hard to do that in Arkansas.
So with the people, but back to that question, with the people that have that titanium implant, what kind of results?
We've had great results. I had a patient, for example, that was a 16-year-old patient that had juvenile rheumatoid arthritis. I mean, her chin was literally back at her neck, not even able to function, barely breathe, could not chew her food. We replaced her joints with artificial joints. Today, she's got 2 children. She's my biggest fan. She's living a normal life, got a great job, has a wonderful husband. And those are the kind of stories that we see every day when we're managing these patients.
So the challenge, though, is people need to find out where you are.
Right.
And it's common that people get on a plane and go see you.
We're fortunate we have patients that travel from all over the country. We had a patient recently from another state that came in that was a seamstress, and she just could not function. She made wedding dresses, and she just could not do her job.
Why? I mean,
because she was having
symptoms?
pain. She was waking up with headaches. She couldn't focus on the details of the wedding dresses. And we were able to relieve her pain with surgery. She's got a wonderful bite now. She makes me cakes and cards and
so they're very thankful.
Yeah, it is. It's one of all the things that I do in my practice. It is the most gratifying thing that we offer for our patients.
The TMJ. You know, most people with TMJ disorder, we're talking, okay, so migraines, clicking, popping, the teeth are starting to wear, or or shorten. People wait, I guess, until, especially men, right? They wait until they have to go see you. When should somebody go in and get evaluated by you?
I would tell patients anytime they have symptoms, if they feel like they're not getting any relief either on their own or with their dentist or their physician, then I think they need to seek out someone that has expertise in TMJ.
Do you have patients that say, I should have done this years ago? Because I guess they're suffering for years before they get to you.
Many patients. Most of the time I'm seeing patients at the end of
Stage.
It's their last resort. They have searched, they have gone, so dentists have tried to treat them non-surgically and conservative, which is great, and I'm all about conservative therapy, but they've gone through 10 years of conservative therapy or 5 years of conservative therapy, or they've gone to their physician and they've been treated for years and years for migraines, which is really a muscle tension headache, and they end up having bite problems and they end up with my office. So yes, it's very common for patients to say, I wish I'd have, where were you? Why was there more information out there about jaw joints? Why are doctors not talking about it? Why are dentists not telling our patients about the options that are available?
So early treatment, though, is always better. Like you say, right now you're dealing with the tough ones, but you want to get them earlier on.
I would much rather.
It's less expensive treatment, probably.
And many times, if we can catch them early, and let's say it's just a bite problem, or maybe it's just a patient that's missing a tooth, if we can replace that tooth with a dental implant, or maybe orthodontics, something to get the bite on, they may never need surgery.
Do you ever do a consult and you know right away, you say, boy, this is going to be good. They're a perfect candidate.
There's many times that I can do that, Randy, and tell that a patient's going to be better immediately. But there's also times that I need to get further studies, an MRI or something like that.
The final message, we're completely out of time. To somebody watching this, they have the obvious symptoms. What's their first move?
Come in for a consultation. Let us evaluate you, get to know you, and see if we can find a solution for your problem. There's thousands of people that are suffering that really don't have to, and there are solutions for the problem.
Okay, great. I want to thank you for coming on the show.
Thank you, Randy.
And they can go to your website, learn a little bit more about this. The
Absolutely,
procedures
absolutely.
That's on there. And you have some patients that actually have done video testimonials.
That is correct.
And they could hear from other patients as well.
Absolutely. They can go to our website, see some patient testimonies, and also many of our patients are willing to talk to patients that have needed this treatment because they want to help these patients.
And you
as well.
treat it orthopedically. Is that right?
I do.
All right. Again, thanks again for coming on the show. Very interesting. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in TMJ, put in Dr. Bolding. Also, on Twitter, if you thought this was informative, you just put in hashtag Wellness Hour and make a comment about Dr. Bolding. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.